Welcome to this explainer. Look, if you're joining us today, chances are pretty high that you or your family are in the middle of a sudden, overwhelming medical or aging crisis. I just want to say right up front, take a deep breath. You are in the exact right place. Today, we're going to walk through a calm, step-by-step starter guide to understanding Medi-Cal in California for the year 2026. We are not doing a deep dive into obscure tax laws here. Think of this as your foundational map to get you from absolute zero to confidently knowing how this whole system actually works.
There's a quote that really hits the nail on the head. Maybe you are sitting at your kitchen table in California with a folder of paperwork that does not make sense, and you are trying to figure out what Medi-Cal even is. I really want to validate that stress right now. Maybe a parent was just diagnosed with something, or maybe someone at a hospital discharge desk threw the word Medi-Cal at you 3 times and you just nodded along because you were exhausted. Well, this explainer is designed to give you the right names, the right questions, and honestly, to point you toward the right doors, so the rest of this journey gets meaningfully shorter for you.
So, here's our game plan. First, we'll cover the Medi-Cal baseline. Then, Medicare versus Medi-Cal, followed by who actually qualifies in California. After that, we'll look at what it covers, dive into the managed care reality, and finally, talk about how you can apply today.
Okay, let's jump right into Section 1, the Medi-Cal baseline. We need to get our fundamental definition straight before we do anything else.
So, first up, we absolutely must define Medicaid. Basically, Medicaid is the federal health insurance program designed for people with limited income. But here's the crucial thing to understand. It's run jointly by the federal government and each individual state. It's kind of like a massive franchise. The federal government sets the broad framework, but every single state runs its own specific version. Texas has its own rules, New York has its own flavor, and they all have their own specific names for the program.
Which brings us to Medi-Cal. Medi-Cal is literally just California's specific name for its Medicaid program. It uses that overarching federal framework, sure, but it applies California-specific eligibility rules, covered services, and managed care plans. Now, the whole operation is administered by the California Department of Healthcare Services, or DHCS for short. They are the state agency in charge of overseeing the entire program, and they're the ones contracting with the private plans that actually deliver your benefits.
Moving on to Section 2, Medicare versus Medi-Cal. Getting these two mixed up is incredibly common, and honestly, it can be a really costly mistake.
Listen, if you take nothing else away from this explainer, let it be this distinction. Medicare is purely federal. It's for people 65 and older or those with certain disabilities, and it's based on your work history, completely independent of your income. It is essentially your hospital and doctor coverage, but crucially, and I mean absolutely crucially, Medicare does not pay for long-term custodial care, assisted living, or unlimited home care. Medi-Cal, on the other hand, is joint state and federal, and it is strictly income and asset-based. So, think of it this way. Medicare is your medical insurance. Medi-Cal acts as the long-term care safety net for those who qualify. It's the one that covers things like memory care and nursing facilities over the long haul.
But, hey, here is some really good news. A lot of older Californians actually end up with both. When someone qualifies for and is enrolled in both Medicare and Medi-Cal at the exact same time, they get a status known as being dual eligible. Being dual eligible is a massive game changer because it unlocks a very specific, combined set of programs and benefits that perfectly integrate your everyday medical care with your long-term support needs.
All right, let's head into Section 3, who qualifies in California? Because, spoiler alert, there isn't just one single eligibility line.
There are basically 2 main pathways you need to wrap your head around, and they use totally different math. On one side, you have the MAGIA rules. MAGI stands for Modified Adjusted Gross Income. This side is for children, pregnant individuals, and low-income families. The math over here is almost entirely based on income, and this actually makes up the largest population enrolled in Medi-Cal. But if you're watching this to help an aging parent or relative, you really need to look at the non-MAGI rules. This pathway is for older adults and people with disabilities. The math here? It looks at both income and assets. And this is the exact pathway that is absolutely crucial for senior long-term care.
Now, within those non-MAGI rules for older adults, there are a few specific sub-pathways you should definitely know the names of. Some folks qualify automatically just because they are Supplemental Security Income or SSI recipients. Others qualify under the Aged and Disabled Federal Poverty Level Program. You might hear people call that ANDFPL. And then for those whose income is maybe just a little too high, there's a share of cost variant. You can think of this basically like a monthly deductible for people whose super high medical needs make Medi-Cal an absolute practical necessity. The exact income thresholds for these do change, but just knowing these names is literally half the battle.
Okay, moving right along to Section 4, what does Medi-Cal cover?
So, while standard medical, dental, which they call Denti-Cal, and vision are all covered, we really want to focus on the long-term structural differences here, because this is where Medi-Cal truly changes lives. For older adults, it covers long-term services and supports. Do not let the alphabet soup scare you, but please look out for these acronyms because you will need to use them. It covers skilled nursing facility care with absolutely no time limit, as long as it's medically necessary. It covers in-home support through a fantastic program called In-Home Supportive Services, or IHSS. It pays for adult day health care, known as Community-Based Adult Services, or CBAs. And under the Assisted Living Waiver, or ALW, it can even pay for assisted living in licensed residential facilities in certain counties.
Now, you are probably sitting there wondering about the exact financial thresholds, right? Like, what does all this care actually cost in the open market right now? Well, we intentionally aren't reciting those specific dollar amounts today because they fluctuate, and honestly, we want to keep this lesson foundational so you don't get overwhelmed. But you can find the exact, up-to-date 2026 dollar amounts and a full cost of care dataset at this specific link, californiacarecompass.com/data/california-cost-of-care-2026. Seriously, take a moment to pause and write that down. It's a free, openly sourced tool that is amazing for helping you calculate your family's exact financial situation.
Let's transition to Section 5, the managed care reality. This is the big reality check.
Navigating health plans dictates how you actually get the benefits we just talked about, and most families don't realize this on day one. Here's how managed care works. The state itself doesn't deliver your care directly. Instead, DHCS contracts with private health plans. These are names you definitely know, like Anthem, HealthNet, or Kaiser. Once you're enrolled, you're assigned to a plan, and that specific plan becomes your day-to-day point of contact. You have to use their specific provider network. But here's the massive critical catch. You must actively ask for long-term care benefits. These plans manage the benefits, but they are gatekeepers. Actually, scratch that. They're more like a vault. They rarely, if ever, volunteer programs like CBAS or the assisted living waiver to you out of nowhere. The family that knows the exact names of the benefits to ask for gets them. The family that doesn't know, unfortunately, usually goes without.
Which brings us to our final section, Section 6, how to apply today. Let's make this actionable. We've broken this down into 4 really systematic steps for you. Step 1, gather your basic documents first. We're talking ID, proof of California residency, income, and asset documentation. Having all of this in one single folder before you even start will save you literal hours of frustration. Step 2, choose your application path, which we'll break down in just a second. Step 3, always check for Medicare dual eligibility if your loved one is 65 or older. And finally, Step 4, once you apply, get your determination in writing, actually read it, and keep it safely stored. You always have the right to appeal if anything looks incorrect. Now, for that Step 2, you essentially have 3 distinct doors you can walk through to submit your application. First up is BenefitsCal, over at BenefitsCal.com. This is the unified online portal, and it's the path most families use today. Second, you can go through your local county social services office. They are the official intake point, and you can apply in person, by mail, or even by phone. And third is Covered California at coveredk.com. That's the state's health insurance marketplace. If you apply there and your income happens to be low enough, your application is actually automatically routed straight over to Medi-Cal.
Now, I know some of you are looking at all this and thinking, my situation is incredibly complicated because of assets or property or very specific long-term care needs. If that's you, please do not panic. Before you submit any application, you should contact the California Department of Aging, or the CDA. They run a phenomenal program called HICAP, which provides counselors who offer completely free, totally unbiased guidance for families dealing with complex asset protection or long-term care planning. Definitely use them. They are a literal lifesaver of a resource.
Well, that brings us to the end of our explainer today. Look at how far we've come. You now know that Medi-Cal is just California's Medicaid. You know the exact difference between those Magi and non-Magi math rules. You know the golden acronyms for long-term care like IHSS and ALW. And most importantly, you know that you have to proactively ask your managed care plan for them. Honestly, understanding the structure of the system is the hardest part. But now you have the vocabulary to navigate it with confidence. So take a breath, look at that folder of paperwork on your kitchen table one more time, and ask yourself, which of these doors is the right one for your family's future, and what will your very first step be tomorrow?